Welcome to the deep dive. We're here to sort of peel back the layers on complex government documents, figure out what they actually mean in the real world.
Exactly. Make sense of the jargon.
And today we're tackling a really significant one, a presidential directive, Executive Order 14187.
That's the one titled Protecting Children from Chemical and Surgical Mutilation.
Right. Signed by President Trump back on January 28th, 2025. Then it hit the Federal Register a few days later, February 3rd.
Yeah. Document 2025-02194 for anyone tracking the specifics. Volume 90, page 8771.
So our mission today, for you listening, is to really unpack this order. We want to break down its core policy, get clear on the specific terms it uses.
Because the language is very specific.
Exactly. And then explore the actions it tells various federal agencies to take. Because this touches healthcare, funding, insurance, the legal side of things, all concerning individuals under 19.
It's pretty wide-ranging.
Definitely. So let's start at the beginning. What's the basic idea? What's the fundamental policy laid out in this executive order?
Okay, so Section 1, Policy and Purpose. It lays the groundwork. It states, and this is a direct quote, that medical professionals are maiming and sterilizing a growing number of impressionable children.
Wow, strong language right out of the gate.
Very strong. It continues. Under the radical and false claim that adults can change a child's sex through a series of irreversible medical interventions.
And it frames this how?
It calls it a dangerous trend and says it will be a stain on our nation's history and it must end. So the tone is quite urgent.
Does it list specific harms it's concerned about?
It does. It talks about children potentially regretting mutilation, inability to have children later, or breastfeed. Lifelong medical issues.
Okay.
A losing war with their own bodies, sterilization, and even points to potentially high medical bills down the line.
So given that premise, that whole setup, what's the actual policy the order then declares?
It's very explicit. It states, it is the policy of the United States that it will not fund, sponsor, promote, assist, or support the so-called transition of a child from one sex to another.
Right, no federal backing for transitioning minors.
Precisely, and it adds, and it will rigorously enforce all laws that prohibit or limit these destructive and life-altering procedures. That's the core policy statement. Everything else kind of flows from that.
Okay, that sets the stage. Now, you mentioned the language is specific. Definitions are obviously key here.
Absolutely. Section 2 defines the key terms.
Like child. Seems obvious, but how does the order define it?
Child or childra is defined as an individual or individuals under 19 years of age.
Under 19. Okay, broader than 18. And pediatric.
Simply relating to the medical care of a child. Pretty
Okay.
standard there.
Right, but here's where it gets, well, really central to the whole order. That phrase, chemical and surgical mutilation, how is that defined? It's a very loaded term.
It is, and the definition is quite detailed. It covers three main areas. First, the use of puberty blockers, including GnRH agonists, those are drugs that pause puberty and other interventions, to delay the onset or progression of normally timed puberty in an individual who does not identify as his or her sex.
Okay, so puberty blockers used in that specific context. What else?
Second, the use of sex hormones, such as androgen blockers, estrogen, progesterone, or testosterone, to align an individual's physical appearance with an identity that differs from his or her sex.
So cross-sex hormones for minors.
Yes. And third, surgical procedures that attempt to transform an individual's physical appearance to align with an identity that differs from his or her sex, or that attempt to alter or remove an individual's sexual organs to minimize or destroy their natural biological functions.
That covers a lot. Puberty blockers, hormones, surgeries.
Yeah.
All under this one umbrella term.
Correct. And crucially, the order then adds this sentence. This phrase sometimes is referred to as gender-affirming care.
So the order explicitly equates its term, chemical and surgical mutilation, with what others call gender-affirming care.
That's what the text says, yes. It draws that direct equivalence.
Moving on, the order doesn't just define terms, it also takes aim at existing medical guidelines, right? It mentions junk science.
It does. Section 3 is titled Ending Reliance on Junk Science. It specifically targets guidance from WPATH, the World Professional Association for Transgender Health.
What does it say about WPATH?
It asserts that the blatant harm done to children by chemical and surgical mutilation cloaks itself in medical necessity, spurred by guidance from WPATH, and then claims the guidance lacks scientific integrity.
Strong claims. So what action does it direct based on that?
It directs federal agencies to rescind or amend all policies that rely on WPATH guidance, and it specifically calls out WPATH's Standards of Care version 8.
So a direct rejection of those WPATH standards at the federal level.
That's the directive.
Okay, beyond just getting rid of old policies, what about building a new knowledge base? Does it direct HHS Health and Human Services to do anything specific on the science or data front?
Yes, there are concrete actions mandated for the Secretary of HHS within 90 days of the order.
Pretty quick turnaround.
Yeah, 90 days. HHS has to publish a review of the existing literature on best practices for promoting the health of children who assert gender dysphoria, rapid onset gender dysphoria, or other identity-based confusion.
So a literature review based on the order's perspective.
And also, HHS is directed to use all available methods to increase the quality of data related to minors with gender dysphoria or confusion, or those seeking what the order calls chemical or surgical mutilation. Basically, gather better data to guide practices.
Right. Which leads us to the money. If the policy is no funding, what does that actually mean for hospitals, medical schools, and health insurance? Seems like a major impact.
It's potentially huge. Section 4, defunding chemical and surgical mutilation, tackles the funding piece directly.
How so?
It says that the head of any executive department or agency that gives research or education grants to medical institutions.
Like NIH grants, for example.
Could be medical schools, hospitals receiving federal grants for research or education. Those agency heads shall immediately take appropriate steps to ensure that institutions receiving federal research or education grants end the chemical and surgical mutilation of children.
End it. So institutions might have to choose between those federal grants and providing these specific services to minors.
So that seems to be the implication, consistent with applicable law, of course. It ties federal funding to stopping these practices as defined by the order.
Okay, that's institutional funding. What about insurance? You mentioned federal employees and military families earlier.
Yes, Section 6 and 7 cover those. Section 6 is about TRICARE, the military health system.
Which covers a lot of kids.
Nearly 2 million under 18, according to the order. The Secretary of Defense is instructed to start the process rulemaking, or something similar, to exclude chemical and surgical mutilation of children from TRICARE coverage, and amend the provider handbook too.
So no TRICARE coverage for these procedures for minors. What about regular federal employees?
That's Section 7, dealing with the Office of Personnel Management, OPM. It directs the OPM director to ensure that the big federal health plans, FEHB, and the Postal Service one, BSHB, include language in their 2026 plan year contracts, specifying that carriers,
The insurance companies.
right, the carriers will exclude coverage for pediatric transgender surgeries or hormone treatments.
So similar exclusion. Does it mention cost?
Interestingly, yes. OPM is also told to negotiate to obtain appropriate corresponding reductions in FEHB and PSHB premiums. The idea being, if coverage is removed, premiums should go down.
Got it. This order really does seem to reach into many corners of the federal government. What else is HHS specifically told to do beyond the data and WPPath stuff?
Section 5 gives HHS a very broad mandate. It says HHS must take all appropriate actions to end the chemical and surgical mutilation of children.
All appropriate actions. That sounds expansive.
It is, and it lists examples of levers HHS could pull. Medicare or Medicaid rules, assessments of state Medicaid programs, drug use reviews, using Section 1557 of the ACA.
The anti-discrimination provision.
Yes. Also, potentially influencing things like essential health benefits, the ICD-11 disease classification codes, even the DSM-5 diagnostic manual.
Wow, that's a wide net. Anything else for HHS?
Two more specific things. HHS must promptly withdraw a specific 2022 guidance document related to gender-affirming care and civil rights. And it needs to issue new guidance protecting whistleblowers who report non-compliance with this executive order.
So protecting people who flag institutions that aren't following the order.
Seems to be the intent.
Okay, so HHS has a lot on its plate. What about the Department of Justice? What's their role in enforcing all this?
The Attorney General gets a significant list of directives in Section 8. It signals a pretty active enforcement approach.
Like what?
First, review and prioritize enforcement of the existing federal law against female genital mutilation, and coordinate with state attorneys general on that specific issue.
Okay, focusing on FGM enforcement, what else related to the order's main topic?
Prioritize investigations into potential consumer deception or fraud by entities misleading the public about the long-term effects of what the order calls chemical and surgical mutilation. basically going after false advertising or safety claims related to these procedures.
And potential violations of FDA rules, too, it seems.
Yes, violations of the Food, Drug, and Cosmetic Act are mentioned. Then there's a legislative component.
Oh, so?
The AG is directed to work with Congress to draft and promote legislation creating a private right of action.
Meaning people could sue directly.
Exactly. For children or their parents whose healthy body parts have been damaged by these practices, the order suggests this should have a long statute of limitations.
So creating a new legal avenue for lawsuits related to these procedures on minors.
That's the goal stated in the order. And one more major point for DOJ.
Yes.
Prioritize investigations and actions to end what the order calls child abusive practices by so-called sanctuary states that facilitate stripping custody from parents who support the healthy development of their own children.
That sounds like it's targeting state laws or policies that might protect a minor's access to care even if parents object, possibly involving custody disputes.
That appears to be the context, yes. It mentions considering the Parental Kidnapping Prevention Act and constitutional rights in these investigations.
Okay, that's a lot of directives for a lot of agencies.
Wait,
How does the order make sure this actually, happens? Is there a follow-up mechanism?
There is. Section 9 is called Enforcing Adequate Progress. It sets a deadline.
Yes, the deadline.
Within 60 days of the order's date, all the agency heads involved have to submit a combined report.
A single report from everyone.
Yes, a single combined report to the Assistant to the President for Domestic Policy. It has to detail the progress they've made in implementing the order and include a timeline for future actions.
So accountability is built in.
And that assistant to the President is supposed to regularly convene these agency heads to coordinate everything. The rest, Sections 10 and 11, are pretty standard legal boilerplate severability, meaning if one part is struck down, the rest stays.
Right, the usual legal clauses.
And that the order doesn't create new lawsuit rights itself, and everything has to be done consistent with the law and budgets.
Okay. So that really covers the breadth of it. We've gone through Executive Order 14187, protecting children from chemical and surgical mutilation. We looked at its core policy, basically, no federal support for child transitions. We unpacked that key term, chemical and surgical mutilation, and how the order defines it and relates it to gender-affirming care.
And the specific directives.
Yes, the sweeping directives to HHS, Defense, OPM, Justice, impacting funding, insurance, healthcare guidelines, legal enforcement. Hopefully, this deep dive has given you a much clearer picture of what's actually written in this significant presidential order.
It maybe leaves you with something to think about. Considering just how many federal agencies, departments, funding streams, and legal areas this executive order touches, how might these directives actually reshape the landscape of healthcare, federal funding, and legal rights for minors here in the U.S.? And, what kind of ongoing debates or challenges might pop up from putting such a comprehensive federal mandate into practice?